If you're going to use a dentist with the complexity of this problem, you want one that's very familiar with this. And yeah, in a big city like this, we have a lot of pediatric dentists around, probably better trained in this than a general dentist. But I'm sure there's some general dentists that had training in this particular area too. Is that true?
It's true, but you really want a dentist that works with a cleft team. Cleft lip, the treatment of kids with cleft lip and cleft palate is a whole art and science onto itself.
So it would be a dentist that had special additional training?
You want someone who works with a cleft team. You need a children's dentist who not only treats kids but also works with a team.
So it's even a more specialized pediatric dentist.
Exactly.
Because obviously teeth coming in, location of teeth, spacing of teeth, the jaw may not be lined up correctly.
Part of the problem is that kids that fall outside the teen care, they don't necessarily get as a thorough care because they get someone who may not be familiar with certain techniques that are used to anticipate certain problems, and even in their attempt to try to help the kids, they're not as well informed. So people that stay with a team, doctors and therapists that stay with a team, really are on the cutting edge and know just when and how to do things. And the concept with a cleft team is that each procedure is going to be billed and get ready for the next procedure.
So in other words, if you had a kid born, the cleft lip, palate, or combination, today you can expect great results in most of the cases, especially if you use the team approach. And even though it doesn't look so good, you can see from some of the pictures that I've seen around here that you start off with a problem. You hardly would notice this. You look real close to see a little line or something. So there's great results. Of course, the end results is going to depend on the complexity of all the other problems. Is that true?
That's true. But it does start out with a fairly frightening problem. And I wanted to mention this, that over the past few years, things have changed a bit. Probably when I started practicing and got involved with interesting cleft lip and cleft palate care, it was a total surprise to a parent that a baby was born. Unless, of course, the parent had a cleft lip or they had another kid, they would not suspect it. But right now, all pregnant mothers have ultrasound, and the ultrasound is so sophisticated that they can visualize a cleft really at the 3-month interval, at the 3-month stage of pregnancy. And so they can now tell a parent they think there's going to be a baby born with a cleft lip, and they can follow it, and then as the baby gets older and they can see it, a parent is well informed and doesn't have that initial shock.
Also, you can get and check out the team you want to use for particular problems. So.
Right. So a lot of times I see a parent that comes to me beforehand, and I'll be able to explain things and let them know. That's a big benefit, I think, because they know it, and it just takes the shock away. They're well informed, they're ready for it, and it's a fragile period of time, babies being born, and you want it to be really an enjoyable period of time, and you don't want to shock them with something they didn't expect.
So in other words, providing we have major other problems, and it's only the defects that are involved, you expect great results down the road.
Right.
A lot of effort, but great results down the road.